Thank you very much. Good afternoon to everyone. Thank you, Alan. I'd just like to inform everybody that without Alan's cooperation and his staff, this study wouldn't have been possible. So we went to different cities and we found out that the data in Malaybalay really suited the kinds of analysis that we wanted to have for this particular study. The rationale of the studies would be as follows. We have noticed that local governments, particularly in cities, have invested in family planning and reproductive health programs. And therefore, it is important to find out if this program is actually more beneficial relative to the other social programs of the government. As we all know, there are many different options on how to improve the welfare of households. And family planning and maternal and reproductive health is only one particular option. So it is also important that we want to find out, in cases where it has proven to be successful, what would be the institutional conditions that can make it effective. And we found out that in Malaybalay, all of these institutional prerequisites are actually already existing. So the objectives of the study would be the following: to determine the impact of these studies on the households and to determine if these programs are indeed welfare enhancing, particularly in terms of how it improves the education and health status of the household. And then from the point of view of the cities, of course, to conduct a cost-benefit analysis that is based on evidence from the household level. In particular, a return on investment will be estimated. So that way we can find out if indeed we should invest in this particular program. I have the following conceptual framework. It's really human capital theory. No? So human capital theory, as hypothesized by so many economists, is influenced by fertility decisions. By human capital, we refer to activities that influence future and monetary and psychic income by increasing the resources of people. No? Of course, this is a quotation from the Nobel Prize winning economist, Gary Becker, who actually focused on human capital. No? Now, the key examples of human capital are education and health, as you probably know from the presentations this morning. One thing that's important to remember is that these investments, these are really investments that households make on their own. And these investments are actually complementary. What does that mean? It means that if you invest in education, the returns in other human capital investments actually go up. So if you invest in health, you will receive more from your education. And if you invest in education, you receive more from your health investments, because essentially, if you're more educated, it's much easier to get involved in activities that are actually healthier in the long run. No? Now, what about family planning? Actually, we believe that family planning is also a human capital investment, because when you engage in family planning, you're actually improving the quality of your children. And by improving the quality of children, eventually you get access to quality education, quality health services. And that's what we want. We want households to actually invest in quality and not in quantity. So that's the reason why we think that along with the other human capital investments like health, education, migration, family planning should be there. No? So such investments often lead to increased participation in the labor market, as has been observed. And in fact, human capital is deemed to be necessary for growth and development. So there's in economics we say that it has a micro and a macro connection. When you say human capital, it affects the basic social unit like the household, and it also affects the whole country as a whole. So we assume that reproductive health is tied to various household decisions, including the demand for children. So if you improve if you try to influence the demand for children, eventually it will lead to better reproductive health. And also at the same time, the overall health conditions of the mother and infants will also be affected. So it forms part of the benefits of family planning and maternal health and reproductive programs. This is the framework for the cost-benefit analysis. So there are certain goals, such as to eliminate unmet needs for modern contraceptives and offering full coverage of recommended maternal and child care. No? And the immediate impact of the program, which we try to measure, of course, is the decrease in unintended pregnancies and unplanned births, and also an increase in the number of women receiving timely and life-saving care. No? Of course, the program will entail certain costs, so there's an increase in the cost of family planning services. But at the same time, if you invest in family planning, as you improve the health of the mothers, there's also a decrease in the cost of maternal and newborn care. No? So in a sense, there's some savings. And also, of course, if you invest in maternal and reproductive health, there's an increase in the cost of these kinds of services. But if you have family planning at the same time and you make the mothers healthy, you actually save also a little. No? So these are how we view the situation as far as the cost is concerned. And as far as measured benefits, these are the things that we try to measure: decrease in maternal deaths, decrease in maternal morbidity, decrease in newborn deaths, decrease in child deaths, and on education and increased enrollment of children. So these are the things that were available readily from the data set. No? There are actually two questions that you might have in mind. Of course, I'll be giving you the results that we have, but two questions might come up. No? So first, would household characteristics affect the benefits derived from family planning programs? So we have a measured ROI, for instance, but would that measured ROI be dependent on the type of households that are found in this city, particularly Malaybalay, right? So is it possible that this thing is only happening in Malaybalay, for instance? Another question is, would the features of the family planning program in Malaybalay also affect the ROI? So is it possible that the study would only be relevant for an economy or a community like in Malaybalay? The answer to both questions is actually yes. No? So we have to be a little bit careful to just say this will apply to all cities, because there are certain characteristics that are found in this area that might be unique. So, but in any case, we try to control for these factors. So if you're so to some extent, it may be also applicable to your communities. No? What is important, however, if we're not able to control it, is that we have a clear picture of how these factors actually affect the estimation of the ROI. So that when you go back to your cities and your communities, you know what are the things that you need to control, what are the things that you have to look out for. So these are the main points that we want to have in our study. So for implementation, we try to say something about what are the prerequisites, for instance, so that you will get the same ROI as that is found in Malaybalay. For this kind of study, if you will notice the framework, no? I'll just go back to the framework. This one, no? So you have measured benefits, like decrease in maternal deaths. Of course, all of these things are determined not only by family planning. There are other factors that may affect it. No? So that's why we want to come up with a study so that we can isolate the effects of family planning. And this will require a certain kind of data. No? We visited different cities and we found that some of the data may not be available for this kind of study. No? So ideally, the data required, the data required for a proper evaluation will include a series of household surveys. And if we're able to account for the previous use of family planning that is no longer dependent on present household characteristics. No? Now, what does that mean? It means that there are some unobserved characteristics in the households that may affect the benefits and the outcomes. So we need to control for those unobserved characteristics as well. No? But if we're able to somehow make the family planning no longer dependent on these household characteristics, perhaps those unobserved characteristics can be ignored, and therefore we can, in that case, we have isolated the family planning program and say that, and we could say that the result can really be attributed to the family planning and not to anything else, because other programs could also affect those benefits. So we were really very, very careful in making sure that we can come up with the right attributions. So that's the kind of data that we have. We wanted a data that is long-term, a series of household surveys over a period of time, so that we can actually do this particular technique. No? So if you want to do this kind of analysis, it is crucial to have information collected from the same households over time in the form of a panel survey, and this would allow one to control for household characteristics. So one major criticism is that maybe it's education, it's not really family planning that's affecting the welfare of the households. But we've controlled for education already. So that's the kind of analysis that we've done. We want to make sure that there is some kind of causal relationship and not just some correlation that we're looking for. No? And then the issue of a counterfactual. No? For this kind of study, we want to know the with family planning and the without family planning situation, so that we can say that whatever the difference is, it is due to the family planning. But when we went to Malaybalay, it turns out that that is not really the right counterfactual, because a number of people were already using family planning that were privately sourced. So the right counterfactual, or if we're going to look for, a with and without the program analysis, what we wanted to do was to find the difference between those who are getting family planning from a private source and those who are getting family planning from the public office, from the public sources, no? Meaning from the local government. No? So that is what we did. No? So in the Philippines, actually, the relevant counterfactual may not be those who are not using contraceptives and other family planning commodities. No? What is the right counterfactual is actually those who are already privately using these commodities without government support. No? Okay, so of course we also try to come up with some difference with those who are not using family planning at all. But it would seem that the more relevant analysis is to compare those who are using family planning that are coming from from the market, and those who are using family planning that are coming from the local government. So since the overall benefits of private family planning are already felt, we also, meaning the idea is that the family planning commodities are already available, no? Privately. No? You can access it. So the question perhaps is there a need for government intervention, right? Should the government still come in? So that's also one of the questions that we try to answer in this study. So how do we measure public family planning effects? No? So if you will look at this graph, there are two lines. The first is the private family planning user. That is the family planning that is not coming from the local government. And then you have another line from the public planning user. No? So presumably, with the use of family planning, the probability of dying early would be somehow reduced. No? But if you look at, let's say, the family planning user from time T0 to T1, if you look at simply that line, it would seem that the effect is from A to C. If you look at the y-axis or the vertical axis, it would seem that if you just look at family planning, public family planning user, the effect from time T0 to T1, the time is in the horizontal axis, right? It would seem that the effect is from A to C, but actually that's not the effect, because if there had been no public service, the household would have gotten it privately. So if there was no public program, the household would have also been able to reduce the debt probability of deaths from A to B, right? So in effect, the benefits that you're getting from the public family planning is only from B to C. Because had you had no program, there would still be some effects, but that is from the private. But in reality, if you're trying to measure the effect of the public family planning service, it is only from B to C and not from A to C. Of course, if the private family planning service does not have any benefits, then the returns would be fully from A to C, from the public service. But if you observe some benefits from the private source, then the benefits will be from B to C. Anyway, we thought that this picture is good. It's a nice picture to have. Anyway, so the question now is, we're saying that actually public family planning is more effective in this diagram. No? If we just let the market be by itself and let the people just buy it from the market, the returns would only be A to B. But now we're saying, no, there's more than that. No? It's B to C. So what are the additional benefits that come from public intervention? No? Well, we based on our focus group discussions that I did in Balay, there was a lot of counseling on the proper methods and the types of family planning management. So if you go to the health office, you're able to get some advice on what would be the right method. If you just get it from the market, it may be difficult to get those, the kinds of advice and counseling that is needed for this kind of technology, right? And also in the long term, the public service tends to be more sustainable, no? Because you're being followed up by the public health office. So in the long term, there's a sustainability of the program. No? And also, if there's public intervention, you introduce a lot of targeting systems. No? So you're able to provide the service to those people who really need it. And those who probably don't need it may actually just get it from the market. But the thing is, you're able to come up with the right targeting. No? And therefore, the program becomes more effective. And also, apart from family planning, if you go to the City Health Office, you get a lot of information about the other programs. You get information about income opportunities, you get information about housing opportunities. They will also tell you about the health services that you can still avail of, and also what are the educational programs. No? So these kinds of, you might say, convergence of different programs from the local government become more accessible to the household. No? If there is such a public family planning program. So this is what we hope, or this is essentially the reason why we think that public family planning is more effective. No? Because of course, if there's family planning, the woman would have lesser children to take care of. But what is she going to do with her time? Right? There's a chance that she might be healthy, but of course there are many other possible problems medically. So she has to have some health programs as well. So what we're saying, it's not just family planning to make it effective. You need the other programs as well to sort of catch these women who have availed of this. And so therefore, in the process, as I mentioned, human capital is complementary. You're able to maximize the returns of all of these investments. Okay, now Balay is a very ideal place for this kind of study. No? So we thought it's an ideal experiment. Actually, the method that we use is you might call it an experimental design. No? So it's an isolated area, therefore no contamination from the other programs in other areas. It's difficult if like in Metro Manila, each city has their own program and the households will be moving from one place to the other. It's hard to track where is that service coming from? So, of course, it can be done, but it's a little bit more difficult. Also, other programs in other areas that have the same programs as Malaybalay. So, one problem, like education, you might have gotten some, some subsidy for education, but you can leave the area, and then you lose the city in a sense loses its investment. But in this particular case, Malaybalay, the migration in Malaybalay is not too much of a problem. In fact, more people would come in rather than leave the place. So we don't have this problem of people going out of the city and therefore the city losing much of its investments. And then you have very limited calamities. And there is also in Malaybalay a very comprehensive health program that integrates family planning, maternal reproductive health, along with the other health programs. I think Mayor Flores was a medical doctor, and his priority is really health. So Malaybalay really has a very good health program. Along with this are livelihood housing projects coming from NGO and government agencies. So it's a very dynamic city, and much of the investments that they have done, I think they're beginning to reap it lately, more recently. But more importantly, actually, the Malaybalay has this integrated survey system, where they're able to identify the beneficiaries and non-beneficiaries of this program. And that's the kind of data that we need, so that we can isolate the family planning program from the other factors and be able to come up with the right attribution. They started this in 2008, so it's from 2008 to 2010. Well, it's only 3 years, but hopefully over time we can get more data and then we can come up with a study that would be more, you might say, robust. That will have more veracity. So the family planning program in Malaybalay has the following characteristics. First, they followed closely the prescriptions of the DOH. There was no cutting corners. They really followed it to the letter. And then they have an annual budget of 1 million pesos allocated for the family planning program under the so-called CSR LEAD initiative. And then they have all of these public consultations with barangay every year. So the people, sometimes they would go door to door, they will tell people that you have this family planning program, but along with that information, they also inform people about the other local government programs. So it's not just family planning, it's a whole integrated set of programs that are given to the people. They also give incentives. They have this 50% discount on commodities. You might say, why is it only 50%? Actually, it might be good because you also don't want to give it for free because people might abuse it. So if it's 50%, that means that people are really willing to, if people are willing to pay 50%, that means that they're really serious and they're really going to follow up the program. They also gave 1 sack of rice for vasectomy before, but unfortunately, I think the doctor who did these things had to leave the village. So they were really serious about the whole family planning program. It was not a wishy-washy kind of program that they implemented. And they complemented it with skilled care at the time of birth and quality obstetric care. So, as I said, it's a comprehensive program. What's also unique about Malaybalay is the prevalence of women organizations. Even way back in 2005, they have recorded many women organizations. It has already been established in 44 barangays within the city. So there are women groups scattered all over the place. And some are still processing requirements, to get certain programs. And as of 2005, they were given some kind of assistance by the government. So the government was also, supporting these kinds of women's organizations. This phenomenon is actually found in other countries as well. in countries where family planning has proven to be successful, it turns out that there were also women organizations. So in a sense, the family planning is just replicating what has been found in other cities. No? And all of these, you know, with the women organizations, this has led to more programs intended for women. No? You have self-enhancement, skills development. There's maternal health and child care that they offer because of the prevalence of women organizations. They have this productive skills and livelihood program for women, and also the human capital, no? Community participation, skill development. So the government was, you know, promoting, in a sense, gender development along with family planning. So it's not just family planning, but you know, the kind of institution is such that it's not one facet only. No? It's a comprehensive program. And what are the accomplishments? I hope the table would be clear enough. No? So if you will notice, already 68% are using family planning. No? So that's quite a lot. I don't know if the other cities would have the same, but in Malaybalay, it's really, there's only a few that are not using family planning. No? But of the 68%, only 30% or 27%, in fact, it has fallen recently. No? Perhaps because of maybe limited budget, things like that. But somehow they you know, they're able to get at least 27% recently. Now, if you look at the maternal deaths, it's quite low. No? So it's maybe because of the health program. It's not because of family planning. But the problem is that if you have this kind of data and you have only limited accounts of maternal deaths, you cannot measure the effects of the program because there's only a few instances. No? So what we just studied is the number of women deaths, number of child deaths, and the number of infant deaths. No? So this is the kind of study that these are the kind of benefits that we tried to measure. You will also notice that it seems to be increasing. No? So there could be a number of reasons why the number of deaths of women, children, and infants are increasing. It could be because of other factors that may be reflected in time, no? Or maybe changes in policies. Or it could be because the family planning may have somehow been slowly weak. It could be slowly weakening because of certain budget constraints. So even Malaybalay has, you know, it's not a very easy program to implement. No? So they need, in other words, they may need a lot of national support. In other words, to maintain the program. Now, the household characteristics, as we said, there are certain characteristics that we need to take into account. No? Now, you will notice, so I divided it into 3 categories: the non-family planning users and the family planning users who are getting it from the private, and then the public family planning program. You will notice that the public family planning users are more or less in the ages from 24 to 34. No? Especially for the public family planning program. So these are probably women or mothers who already have children, and they really need to have some kind of family planning. There's a demand for it, in other words. So it would seem that the program is somehow able to somehow identify these women. No? And also, if you look at the father's age, the same thing. No? For those public family planning users, they are in that particular age group where the demand for family planning is quite high. No? So, of course, the difference may not be too significant, but nonetheless, it would seem that there's some kind of targeting system that's going on where the public agency is able to somehow identify who need it the most. Now, the education of the parents, you will also notice that the private family planning users are usually the more educated ones. No? So generally, they probably are the more, you might say, the well-off households. No? And the non-family planning users and the public family planning users, they're usually have lesser education. So you might say that, well, the difference is not too much, but the thing is, it's quite clear that those who are getting it from the market don't probably need any public subsidy. So there is some unmet needs, in other words, and the local government is somehow able to satisfy some of those unmet needs. There might still be some unmet needs from those who do not use family planning. So other characteristics are as follows. The household size are more or less the same, but you might, if you look at the public family planning users, it's slightly higher, a little bit higher. The house. So they probably have, they have more children, in other words, on the average. Now, nonetheless, if you look at the table, even though they have more children, they are also able to enroll their children as much as the other families. And if you look at the next rows, these are engagement in the labor market. You will notice that those who get the family planning from the private are those who are more involved in permanent work. These are probably in the service sector. But you will look at the non-family planning user. Most of them are in contractual and seasonal work. These are usually in agriculture. But if you look at the public family planning users, they are the ones that are involved in temporary work. Like these are often in the informal sector, and they're also more engaged in volunteer work. So to some extent, the program is able to somehow be able to service those households or those women whose income is not, you might say, risky, on a temporary basis. So that somehow they're able to help the poor, in other words. But you will notice the difference between non-public family planning users and public family planning users. They're not quite significant. So there might be still some poor people who might need the family planning program. Now, as far as birth spaces, you will notice that there's not much difference in the birth space between the first and second child, but there's a significant change for those people using family planning between the second and third child. So it would seem that the program is really intended to target those households who already have children, and we would like to increase the birth space between the second and third children. Now the last characteristic, own house and lot. There's no data on savings. So the only, perhaps a good indicator of how much savings they have is whether they own a house and lot. There seems to be not much difference, in spite of the fact that the public family planning users are actually, you might say, a little less well off. But if you look at the own house and lot, there seems to be no difference across these three categories. So as a summary, the public family planning users are not well off, in terms of, well, compared to the private family planning users, in terms of age, education, employment opportunities. Public family planning users seem to have a larger demand or need for family planning commodities. In particular, they seem to have more children already, so they really need, there's some kind of unmet need that was somehow satisfied by the program. And there are more similarities between non-family planning users and public family users, indicating that there may still be some unmet needs existing. So the empirical strategy is to use econometrics, but it's a little bit complicated, because there are many factors that we wanted to study, so we used different techniques. In some cases, it's hard to control for the unobserved characteristics. In some cases, it's easy, so we just use the observed characteristics. So whichever worked, essentially, given the data that we have, we did that, and we tried to control for time effects, to capture policies over time, the characteristics of the family planning user, the use of the public family service, and then other human capital investments and community features. No? Because there's only we only have data for 3 years, we only are able to measure the 1-year return on investment. No? It's the 1-year health return only. No? Perhaps, I think most of the studies show that family planning has a much longer term. No? I mean, the benefits usually come mostly in the 5th year or in the 4th year. No? So to some extent, our data may be a little bit conservative because it's only for 1 year. No? Hopefully, we'll try to follow this thing up later, and then maybe come up with a better measure of the longer term effects. No? In previous studies, in fact, family planning seemed to have very small returns because they were only looking at the short term effects. No? So, but more recently, long term effects seem to be quite. They seem to be quite substantial. No? So, in any case, we'll try to find out what happens after 1 year, no? And see if there's some effects. But as I said, this may be a little bit conservative. So we have data for 3 years. So from 2008 to 2010. So from the 2008 data, we know who used or who did not use family planning. And then we tried to measure the effect of the use of family planning in 2008 on the 2009 behavior, on the 2009 decisions. So that's what we want to measure. What is the effect of investing in family planning in 2008, and how did that affect the household? How did that affect the household in 2009? And then in 2009, there were people who were using family planning. So we want to find out now, how did that affect the household in 2010? So essentially, the decisions that we're looking at are those that were made in 2009 and 2010. And the family planning are those investments that they did the year before. No? So this is the scheme to sort of take away the effect of household characteristics because they have already invested on that. No? So they cannot change that anymore. So it's already given. No? So whatever findings we can find that we can measure can be solely attributed to family planning and not to anything else because this has already been invested by the families. So we sort of, given this particular strategy, we are able to somehow eliminate the effect of unobserved characteristics. So measuring the incremental effects of public family planning, so it's actually an additional benefit over and above the private use of contraceptives. So I think the graph I've shown you, okay, illustrates how we did this thing. No? And this means that the overall effect of family planning is either enhanced or reduced by the use of the public service. Now, of course, if the quality of the service deteriorates, then the outcomes of interest may also be adversely affected. So our ROI actually is dependent on the quality of the other government services that are found in that area. So we're really interested in the difference between private and public programs, no? And hence the effect of public family planning. So let's look at number of children and birth spacing. No? So in this study, it's hard to control for the unobserved characteristics because the unobserved characteristics that affect number of children are also the same unobserved characteristics that affect private family planning. So we have these so-called fixed effects. No? Unfortunately, if you have fixed effects, you cannot measure the parents' education anymore. No? So you're just simply looking at family planning. And you will notice that the use of family planning was able to reduce the number of children by at least 2%. No? This is the 1 year. It's an average of the 1 year effect between 2008 and 2009. No? The private family planning, in fact, turned out to be positive, but it was insignificant. No? So it seems to have no effect. There were some effects that are coming from the changes in policies. Okay, So changes in policies also affected the number of children. I mean, the time from 2009 to 2010, there may have been certain factors that may have affected the number of children, but we were able to control for that. So if we want to isolate the effect of public family planning on the number of children, we are able to measure that as having a 2% reduction in the number of children. Now, if you look at birth spacing, I said earlier, the birth spacing from first to second children doesn't seem to have any effect. No? Family planning seems to have any effect. And this is verified by the econometric analysis. So in this case, there seems to be no effect both for private and public. No? But if you look at the second to third children, there's at least an increase of 0.12 per year. No? It's hard to interpret the magnitude. No? What seems to be more important is really the sign and whether it's significant or not. No? Because as I said, it's only a 1-year return, and this is census. No? So, but at least we're able to come up with a significant additional effect, no? Coming from the family planning. From the private family planning, there was a higher positive effect, but again, it is insignificant. No? So it would seem that public family planning is really more effective. No? And then we control the other factors. Okay? So parents' education, religion, community, all of those things were controlled. Some have effects, others don't have. Okay. Now the effect on economic household decisions. So the mother's engagement in labor activities. This is multinomial logic. The interpretation is quite tricky. If you say permanent work, for instance, the first column, what you're really measuring is what is the likelihood that you will find more of these women in permanent work than being unemployed, because the base category is not having any work or being unemployed. No? So if you look at the number, it says negative 2.72. It means that the women would more likely be unemployed rather than be found in permanent work. Okay, if they have used public family planning, so that's not a good sign. But if you look at the other categories, no? Seasonal and contractual, temporary and volunteer work, these women would seem to be found would have a higher likelihood of having seasonal and contractual work, of having temporary work, or being engaged in voluntary work than not doing anything at all. No? So it would seem that they have that the family planning opened up certain opportunities for them. Probably not in permanent work. These are service, in the service sector, offices. They probably, it's only a 1-year return. They probably don't have much chance in getting involved in permanent service activities, but certainly they have now a higher chance of being employed in agriculture, being employed in informal sector, and more importantly, they're now more involved in in social programs. No? There's a lot of social capital. So that seems to be the, and if you look at private family planning, the row below, it has no effect at all. No? So it's the sustainability of the program, perhaps, that allowed them to be engaged in these other income opportunities. No? Now, if you look at owning house and lot, as I said, this is our measure of savings. It would seem that, well, it's not so much of an increase, but there's a 0.73% chance that they would now have that they would have owned their house and lot, no? And that is due to family planning alone. No? If you look at private family planning, it's negative. It's positive. It's negative. The land market in Malaybalay is quite active. No? Maybe because it's as I said, it's a very dynamic economy. One year you have a house and lot. The next year you don't have house and lot anymore. So it's quite active. But definitely, if you have family planning, you may have more savings, and then allowing you for at least some chance of owning your house and lot. So there's some, in other words, there's some financial returns as well. No? So it's not just really human capital. No? It's also financial returns that you're getting from this. Now, what about the health and housing outcomes? Again, you will notice that there's an effect, no? Coming from public family planning. So the number of deaths would be 13% lower for mothers. It's slightly significant only, no? But nonetheless, it's still 10% significant. And then you have child, which are all of them are highly significant. The reduction in the child and infant health. Now, for private family planning, there seems to be a significant effect as well. However, I am not able to separate it from the effects of the other factors. In other words, it's possible that the private family planning effects are really coming from education, age, and other factors. That's why when you run it in a computer, there's no number. They're only going to say it's positive, but there's no number because it's hard to separate it from the other characteristics of the household. No? But definitely public family planning is something that can be measured. It's not due to education, it's not due to age, it's not due to religion. It's really due to the service that the local agency provided. And then if you look at the time effects, they're all no, no? It says no. So it seems that it's quite sustainable. No? The changes from 2008 to 2009 did not seem to affect the program. Unfortunately, if you remember that the other table I mentioned earlier, there seems to be some increase in mother, children, and infant deaths, right? In that table. So it's possible that the program is not really reaching more people. No? So in other words, there seems to be some kind of constraint. Because these things seem to be very significant. So if you find some increases in the death incidence, it may be because the program has somehow started to weaken and therefore may need a lot of national support. Now, if you look at the number of children in school, because of family planning, there's a 7.91% increase. No? Not high, not very, very high, but it's still statistically significant. No? But if you look at the effect of private family planning, it's negative and insignificant. So as I said, because of these effects, we say that family planning is a human capital investment. So it's supposed to be a cost-benefit analysis. So how do we evaluate the benefits? No? So since the CBA is undertaken for the city, we use the principle of opportunity cost. No? So the total benefits are based on the savings that the government receives from implementing family programs, as opposed to directly spending on maternal and health programs. No? Because if had there been no family planning program, these people would have been less healthier. And then the local government will still have to pay for them. So with the family planning program, there are some savings because these people no longer have to approach the local government for their other health needs. So that's how we measured it. No? So the value of the benefits is based on the cost of the next best alternative that would have achieved the same result. No? So this is equivalent in economics. We call this the opportunity cost, no, of these other programs. No? Now, in the case of Malaybalay, this actually refers to the Assistance Fund for Individuals and Families in Emergency and Crisis Situations. They have this fund that they give to those people who are at risk, who are on the brink of death. They give money to them. No? And also they give money to the children who are in the streets, no? For the street children. They have budget for children who are not in school. So if you have family planning and you're able to increase enrollment, or if you're able to decrease the death incidence, you would have saved on these programs. And this is how we measured benefits. As I said, it's very conservative. There are other effects coming from family planning. But given this, we may be able to come up with some measurement already. No? So this is our measurement. So this would be the effects, no? The effects, the benefits. You have a 13% reduction in female mortality, infant, 20% in infant, 16% in child mortality, and then the combined is 17%. Now they spent 11 million for the assistance funds, no? For those families in crises and emergency situations. So if you're able to reduce that by 17.15%, you get some savings of 1.886 million. So that would be the benefits from family planning. You're able to minimize your cost in the other programs that you also give to these households. Now, of course, there are, apart from that, you have also the benefits from schooling, increase in enrollment, and they have this program that they spend 1.5 million for the street children. So if you're able to reduce the number of street children by 8%, you get some savings of 118,000 pesos. So the total benefits would be around 2 million point 0.5. No? Now, what are the costs? It's very cost effective. No? So they spend 1 million for the commodities. They spend about 100,000 for the women and reproductive health, and then they have the maintenance, operating, and overhead costs. This is based on the total weight of these programs and the total budget. No? So what is the percentage of these programs in the total budget? And then I applied it to the MOE to get the indirect cost. It's only 1.288 million. Therefore, a return on investment of 55.6%. This means that for every 1 peso spent in family planning, you get some savings of around 55 centavos, which you can use for the other programs. Like perhaps you can use it in infrastructure. This return is actually consistent with those that are found in other countries. No? So in other countries, they would say that the cost of family planning is 6 times lesser than the other social programs or certain environmental programs. No? In Africa, for instance, they say that for every $1 spent in family planning, there's some savings of $4. No? But these are long-term studies. No? This is only 1 year. No? So for 1 year, and then maybe for the investment 2 years ago, will still have some effects, right? So this is really rather conservative. Yet it's already quite remarkable, no? Because if you look at the return on investments on infrastructure in the Philippines, it's only around 8%, no? According to the World Bank. In other countries, it's 29%. That's the best case already, but this one is 56%. No? So if you want to make the other programs more effective, you could actually put the family planning alongside with it. So in that way, you are able to save on the other programs. So conclusions, the family planning and maternal reproductive health programs possess 2 mechanisms in improving welfare. No? So it improves the probability to engage in the labor market, resulting in savings as evident in the higher probability of owning a house and lot. No? They also lengthen birth space, especially for the third and succeeding children, which leads to better health, as we have found out. No? It reduces the probability of deaths for infants, children, and mothers, as well as increasing the number of children enrolled in schools. And we also showed that public intervention to be most effective and targeted to households with the most unmet needs, especially the poor. And the family planning programs are implemented alongside other programs, especially those that promote the interest of women. And based on the budget for alternative programs and actual cost of family planning, maternal reproductive health programs, an ROI of 55.6% was estimated. Now, what about policy recommendations? No? So these are the institutional issues that I was talking about earlier. So one needs to improve the family planning programs with the view of giving better and sound advice on the different methods of family size management. So it's not just giving them the commodities. You have to counsel them on how to use it and what would be the more effective programs. You allow the family planning beneficiaries greater access also to income opportunities and health services to maximize the benefits arising from these programs. These are not additional costs. No? The income opportunity and health services are already there. It's, you don't have to spend more on the income opportunity. I suppose there are already programs in the cities for these. It's just really a matter of informing the family planning beneficiaries that there are such programs available, so that once they are, free of an additional child, they can avail of these programs. Promote women development programs that lead to greater social protection and the achievement of Millennium Development Goals. And it's also important to design some kind of targeting to identify those with the most unmet needs. Family planning is both equitable and efficient, right? It helps reduce inequality, and it also makes people more productive. So it's not just for efficiency, but it's also for equity, for poverty reduction. Of course, we need data in order to manage these programs. So if you want to, better manage your program, you must have the necessary data, like the one that we found in Malaybalay. So as I already mentioned, that the family planning is a possible alternative to poverty reduction. On the national level, well, there are externalities. It's not only Malaybalay that benefits from these. No? A lot of people from other areas also go to Malaybalay. No? So we need national support to subsidize these kinds of best practice services. Okay, these are things that benefit not only Malaybalay, it also benefits other areas, no? The whole country in effect. So you have a more productive workforce because of improved health, higher earnings leading to lower poverty, increased enrollment, and growth and development. It's an investment in human capital. No? It's an investment in quality. No? Okay. It's also cost effective. No? I think Secretary Cabral knows that I used to be a consultant for CCT, and I'm not quite satisfied with the CCT right now because there seems to be it's so expensive, it's so large, and the coverage may not be too much. And maybe because of the fact that we haven't managed our family size yet. No? This program was patterned after the Latin American countries, which had already experienced a demographic transition way back in the 80s, no? Along with Japan and Korea. But we're still in that, we haven't reached that transition yet. No? So you will notice the program gets larger and larger as you try to reach more and more people, and the larger it becomes, the more supply side problems you will meet. No? But of course, you can argue also that the conditional cash transfer reduces family size, because the household will now be induced to invest in quality. So they will decide, because of the conditional cash transfer, to have lesser children. But the question there is, how are they going to do that if there's no family planning? No? How are they may want to reduce their number of children, but there's no technology that will make it for them. So perhaps we should combine the two. No? If you want both, then we should combine the two, because, as I said, there are complementary. No? These are complementary programs. No? So hopefully with a combined family planning and conditional cash transfer, there will be greater coverage of the intended beneficiaries. And then finally, my last slide, we cannot just let the market supply these goods. No? It has to be available to households who need them. No? And you're able to better maximize your benefits if it is provided as a public service. And more importantly, it becomes more sustainable if it's provided as a public service. It's no longer dependent on the conditions of time. Thank you very much.